This is what you can do about your health, a podcast about how you can make your body healthy, strong, fit, and inhospitable to disease. I'm Sean McClennan, your host. I'm a certified personal trainer, an author, and health and fitness enthusiast. Thank you for joining me today. The information on this podcast is based on personal research and opinion and experience, and is not meant to be a substitute for advice from a doctor or physician. You are advised to consult your doctor or physician before making any changes to your lifestyle. Before we get into this podcast episode, I want to tell you about my featured book, which is my book called What You Can Do About High Blood Pressure. Most people know that high blood pressure is one of the leading killers in the United States and other countries, causing strokes, heart attacks, and kidney disease, to name a few. But what many don't know, however, is that high blood pressure is a lifestyle disease, meaning it is caused by the way that we live our lives. This book, What You Can Do About High Blood Pressure, will empower you with lifestyle changing strategies to lower your blood pressure naturally. The book includes in-depth information about what causes high blood pressure, natural ways to lower your blood pressure without drugs, and a 4-week plan for implementing the blood pressure lowering strategies into your lifestyle. There are natural ways to control high blood pressure that you can start today. Are you ready to adopt a healthier lifestyle and reduce and possibly eliminate your need for blood pressure medicine? If so, this is your book. Look in the description and click the link to get your copy of What You Can Do About High Blood Pressure today. All right, so today's topic, I want to talk about how heart disease looks different in women. This is important to note. One, because heart disease, obviously can be deadly in general. And then two, because um this means if it looks different in women, then this means that we could possibly be missing the signs because we expect heart disease to look a certain way, and it doesn't always look a certain way. Now, we know that for a long time, um health and healthcare and whatnot is kind of approached from a generalized lens that was kind of more so based on um a certain type of what do I say, model. And it kind of tended to favor males, um like white males and whatnot. And just by virtue of the fact that um it's kind of like just the way our society was shaped and designed. And a consequence of that is that, thinking about women in this episode, that sometimes it has caused us to minimize and overlook, miss real health issues in women, because we expect the health issues to present the same way as they do in men. But it's not the case. Think about this. And it is very interesting, but think about the fact that, as humans, you have male and female, and we're human, but we are very different. We share a lot of the same stuff, but then, like, the way our bodies run, the way that we think and all that stuff is very, very different. It's very different. And so it only makes sense that, at least from a certain type of at least with certain things, the way that health issues will present themselves could be different as well. Now, we're talking about heart disease in here. I came across a study that talks about heart disease and how it tends to be presented in women. And again, the reason why I guess this study was done is just because, there's certain type of disparities and whatnot in health that are caused by the fact that we've been looking at um, health from a very narrow lens. As humans, we are all created equal, no doubt. But the thing to kind of note is that the the various differences that we have. Of course, you have biological differences. You have differences like in our ancestry, where we come from. Those literally mean, like, for example, and we're not getting to that in this episode, but ancestry. One thing I think about as an African American, of course, my people come from somewhere in Africa. At least most of my genetics stem from that area. And so my people adapted over many, many, many years to that particular environment, to that climate and whatnot. So the type of climate that my people come from is different than the type of climate that, my Italian and French and British um brothers and sisters come from, or my Indian brothers and sisters, or my Native American brothers and sisters, or Asian. It's different climates, different environments, and our bodies, literally, like I talk about all the time, are masterful at adaptation. And so it's important to really note that. But unfortunately, because of the standardization of society, how we kind of make standards and whatnot, which has some value, but it also can hurt too. Whenever we kind of like make general rules that have little to no wiggle room, it kind of causes some people to fall through the cracks. So let's get into this. So I'm just going to point out a few things I found from this study for you guys to consider, especially my ladies who listen to this podcast. In interest of you, like, really kind of paying attention to your body, um, to make sure that you're taking the best care of your health possible. So the study said the following things. One, heart disease typically develops later in women. When it comes to people developing heart disease, it tends to appear 7 to 10 years later in women than it does in men. Um, However, it is the major cause of death in women over the age of 65. From the National Health and Nutrition Examination Surveys, from a study from them, myocardial infarctions, that's just a fancy name for heart attacks, have increased in middle-aged women. And middle age is like kind of like between 40 and 65. So heart attacks have increased in middle-aged women in that, like I said, that age group, but they've decreased in men who are middle-aged. Okay. So they're actually going up in women as a trend, but decreasing in men. Going up with women, but decreasing with men. I hope I said that right. The study also said that women were less likely to be referred for testing and tend to be treated less aggressively. So I'm guessing, for example, that means like a lady who's going to the doctor because of chest pain or whatever, may be less likely, for example, to be referred for testing, going to like a heart doctor, a cardiologist, something like that, and may be less likely to be treated more aggressively. Um, okay. So here is where I kind of want to go into some of the differences in clinical presentation. The differences in clinical presentation between women and men when it comes to heart disease. So chest pain, apparently, so this is probably part of the reason why people don't tend to refer or tend to maybe overlook when women are really dealing with heart disease issues. So the study said chest pain is more common in women, but it's less related to atherosclerosis in the large epicardial coronary arteries. So just to kind of break that down, it's saying that chest pain is more frequent. It happens more in women, but it isn't as related to atherosclerosis, which is hardening of the arteries and laying down of plaques in the arteries and stuff like that. So it's more often related to atherosclerosis in men, apparently, um, than it is in women. And the epicardial coronary arteries, epi means center, cardio means like having to do with the heart. So the large cardiac arteries that are somewhere in the center of the I guess the heart. Coronary arteries are heart arteries. Non-cardiac chest pain often mimics discomfort associated with myocardial ischemia. Non-cardiac chest pain, meaning chest pain that's not heart related, often mimics, and this is in women, it often mimics the discomfort that's associated with myocardial ischemia. Myocardial ischemia is the myocardium is like, I think, on the outside of the heart. Ischemia means like a temporary like deficiency of oxygen. And so I guess apparently in women, non-cardiac, non-heart related chest pain is often similar to chest pain associated with, temporary oxygen deprivation to the heart. So it's very similar. But even though it's not necessarily as associated with uh myocardial ischemia, the study said that non-cardiac chest pain is associated with a twofold increased risk of coronary heart disease in 5 to 7 years. So even though it's non-cardiac, it's still associated with twofold increased risk of coronary heart disease in the next 5 to 7 years. So that's important to understand that. So it's like somebody's dealing with chest pain. In other words, it means it's not something to just dismiss, like, oh, you just need to go lay down somewhere and that type of thing. So, ladies, keep that in mind. The study says the implication from this is that women should be treated more aggressively. Um, Women tend to have less extensive obstruction and more diffuse coronary artery disease compared to men, yet the event rate seems higher. So they tend to have less, ladies tend to have less of the, I guess, like the plaques and all that kind of stuff than men do. But the event rate, so event, is like something happening, I guess like a heart attack or something like that. So in other words, the event rate still seems to be um higher in women. It's very interesting. So how is it different? How is it that women seem to have less obstructions and less coronary artery disease, or more diffuse, I mean, but then the event rate, the rate of having some sort of like significant event like a heart attack is somehow higher. That shows that there's more to it than, more to it with ladies than what we've been used to thinking, because we always think about from a male standpoint. Women have smaller vessel size, like smaller blood vessel size, and tend to have more vascular stiffness. And there are differences in the cell walls of blood vessels between men and women. Um, so yeah. Let's see. So yeah, I know I'm getting into a lot of the technical kind of stuff or whatever, but the main thing is, chest pain apparently on average tends to be discounted with ladies more often than with men. But it can be, even if it's not related to the heart, it can be signifying that, stuff needs to be looked into in the hearts of ladies and stuff like that. So it's important to pay attention to any sort of chest pain, especially if you're a lady and you've kind of been discounted and whatnot. Um, Another thing is, let me see. Um, Menopause. It says early menopause is associated with a 2 year lower life expectancy. So like if and that's related to heart disease as well. So if menopause happens earlier, it tends to be associated with a 2 year lower life expectancy. And endogenous estrogen deficiency in women, um those women have a more than sevenfold increase in coronary artery risk. Okay. Um our hormonal differences, hormonal differences between men and women tend to be very much associated with the type of things that would cause heart issues with a woman that obviously wouldn't cause issues with a man, like estrogen and stuff like that. That's not really something that you associate it with men. But in women, estrogens regulate lipids, so like fats and stuff in the blood, inflammatory markers, coagulant system. Coagulant has to do with the clotting properties of blood and other metabolic factors. And all estrogens promote vasodilation, like dilation of the blood vessel walls. So when a lady has deficiency in estrogens, it's a big deal. Obviously, that's not like that doesn't have anything to do with men because our systems don't work that way. But with women, that's a big deal. It's something that has to be paid attention to. Smoking is more harmful to women than men and increases heart attack risk more. Interesting. So for some reason, the study didn't say why, but smoking is more harmful to women than it is to men. Um, and then also the study said that hypertension, high blood pressure, often starts. I won't say tends to, but it often starts during menopausal transition. So that as you know, a lady is transitioning into menopause. Often that's when if they develop hypertension, that's often when it actually develops. So you see, it's some sort of hormonal kind of relationship. And then PCOS, which is polycystic ovarian syndrome, preeclampsia, which is like a situation kind of associated with pregnancy and high blood pressure, very can be pretty risky. Gestational diabetes, which is diabetes that happens during pregnancy, those may also be risk factors for heart disease in women. All right, so I've thrown a lot of different things out there. Hopefully, it's stuff that um you consider if you're a lady, just to kind of understand. It is true. A lot of the way that health in general, has been looked at in our society has been more so based on like a male paradigm. And that has obvious consequences when we understand that our bodies are made very differently, very differently. The hormonal systems are very different. And if they're not taken into consideration, then we can overlook things like I said, estrogen deficiency and the effect of menopause and um the fact that blood vessel sizes are smaller in women and that there is a lot more likelihood of non-cardiac chest pain in women than it is in men. So you see, we have to pay attention to those type of things. And all of that said, for my ladies out there, and of course men too, but for my ladies out there, one thing I do want to really promote is the fact that a lot of what we can do to take care of our hearts and whatnot, whether you're a man or a woman, is about the same. So we all know that if you move your body regularly, that's going to help your heart and it's going to help protect you against heart disease. Getting your heart moving, getting your lungs, expanding and all that kind of stuff will help your heart to stay healthy. Okay? Because what happens is when we don't actually um challenge our heart sometimes to get it to kind of pump more, then it loses its efficiency. It kind of it doesn't pump blood as well, and it has other developments that cause it to become weaker. Okay, but you can't stop at exercise. A lot of people are like, well, I walk every day, but I eat bad. You have to understand that the way that you eat is very influential on like whether or not you're developing hardening arteries and plaques and fat laid up in your blood vessels. That's mainly from the consumption of a lot of junk food. Junk foods have a lot of these hydrogenated oils, trans fats that lay down fat in your blood vessels. Um, high consumption of saturated fat. That topic is a little bit debatable. Depending, I think, on the quality of the saturated fat, but I think most people agree that even though there are saturated fats that might be a little bit healthier, you still don't need to consume a whole lot of saturated fat, like with animal fats and whatnot. But anyhow, your diet. Oh yeah, and sugar too. Sugar damages your blood vessels. High amounts of sugar damage your blood vessels. So it's very important not just to exercise, but to eat well. A diet that's not high in junk food and starches and sugars, and also not, ridiculous and saturated fats. Sleep is important, of course, for the heart. Um, and just generally having like a practice of, de-stressing, being out in nature, spending time with family and friends, and having, like people say, having gratitude, thanking the Lord, and not necessarily always dwelling on the bad things. These things are important for your heart, whether or not you're a male or a female. So it's important to always note and understand that. Um, I wrote my book, What You Can Do About High Blood Pressure. High blood pressure is very much associated with heart disease. And a lot of times I think it develops way earlier before. So that's something to like really keep in mind. But there is so much that we all can do when it comes to avoiding, you know, I don't want to say managing, because managing kind of implies that you just have it forever. But I'm a firm believer that you don't have to have high blood pressure forever, because it develops again for very specific reasons. Either the body is not getting what it needs, or the body is getting things that it doesn't know what to do with. And so one of the responses could be a higher blood pressure. Keeping your body fat low. Well, when I say low, I mean to an amount that's appropriate for your particular body. That's very important as well. So keep that in mind. So anyhow, I'm just saying all that to say, even as we recognize and understand that heart disease looks different with men and women, it's also important to understand that a lot of the things that we can do to manage, or not manage, but to help prevent heart disease, and to improve the health of our hearts, whether you're a man or a woman, is the same. It's the same. There are going to be some differences as well, as far as like, things that would probably be even more important for women, as far as like the hormonal profiles that we have being different. Um and I will say this too. Now, I'm not an expert on that kind of stuff by any means, but one thing I've learned a lot about over the past decade and a half or so is how we have so many things in our society that throw our hormones off. So many things. So it can be different type of lifestyle stuff, like stress, and of course having diets that are like poor and high in sugar and whatnot, but also our exposure to various toxins as well. Plastics are, we're warming up our food in plastic. We have, sometimes plastics might be in the waterways and all this kind of stuff. um Various toxins and stuff that are used sometimes to grow our food, or that our meat is exposed to, that can have a hormonal kind of effect on our bodies when we consume the foods. Um, Different products that we use on our skin, which, and even think about that. Even with it's like skincare and hair care and all that kind of stuff is a lot more of it's a bigger industry for women than it is for men, for sure. So the amount of exposure that ladies have to different type of endocrine affecting, hormonally affecting chemicals, their exposure is I'm sure a whole lot higher. And so that's something to pay attention to as well. But anyhow, maybe one day I'll kind of like do a podcast more on that. I know sometimes it kind of seems like there's so much going on in this world, so much wrong with the way that we do in our society, that it seems like there's no hope. But I'm a firm believer that you always have hope. There's always something you can do. It's always something you can improve. And there's a pathway, even if it seems impossible. There's a pathway if we'll only take the first step in a new direction. Okay. All right. So I've said a lot. I said a lot of technical stuff. So hopefully you still kind of got the gist of what I was talking about. Share it with your female relative, your wife, your sister, um, your friend, your auntie, your grandma, whoever. And as I always say, let's control what we can control, man. At the end of the day, control what you can control. and understand that you have the power to do that. Make sure you comment, like, share, subscribe. Make sure you get a copy of my book, What You Can Do About High Blood Pressure. The link is in the description below. And always remember, your doctor is not responsible for your health. You are. God bless you.